What would you leave your fellow physicians with as far as words of encouragement? What you want them to focus on when they interact with their patients and things like that? What do you want to see more of in the field or in the research?
I think it's very important in the field to expand on the point you mentioned, is treating the patient as a whole, really making sure we are helping the patients with the challenges they are seeing in every day. And we have some examples for amazing efforts on that at UCSF and in other institutes as well. Um, from a biomarker point of view, I think we need to communicate with the patients what those biomarkers mean. There are certain different assays available now, and the patients might have access to those different assays. Some of them are approved in the US, some of them are approved in Europe. We need to tell the patient that a high biomarker value is not very straightforward to interpret. It needs really some expertise in understanding that the value from one platform is different than the other. So we are trying to use those tools, but I have to say we are still also trying to understand how to bring this knowledge to the individual patient.
Mm. So it seems like a matter of communication, like having a standard way to help patients understand these factors so that they can understand their own disease themselves, or
Absolutely.
yeah.
Like if the patient would measure NFL, or if the patient would see their NFL values during an acute relapse to be elevated, we have to explain to them that this does not necessarily tell us a lot about their progression risk because it was measured during relapse. But what it might tell us is that they had an inflammatory event, and we need to make sure that the inflammation is suppressed in their cases, and that those biomarker values, they take time to change. Like if you measure NFL now, they are elevated, and you start a new treatment, you wouldn't see the NFL values to be low in a week or two. It will take probably a couple of weeks until they are notably lower. So we need to communicate those things with our patient when we start applying our biomarkers in everyday care.
Do you have any words for patients as far as what you would suggest for them when it comes to advocating for themselves if they've been diagnosed with MS? What are some of the places that you think that patients could use more advocacy?
um, I think it's very important for the patients to know that they should really discuss everything that matters to them. There are some hidden MS symptoms that maybe in the busy clinical setting are not addressed substantially, like cognitive symptoms, like depression, like fatigue. And the fact that the patient is stable, for example, regarding disease relapses, they are not getting any relapses, does not mean that the other symptoms are not important. So it's really important to bring that to your physician if they didn't discuss that. And I know there is very low, like growing awareness in the field of MS physicians now that we need to actively address those symptoms, but patients should advocate for that as well. And there are very good examples from the National Multiple Sclerosis Societies with specific funding mechanisms for symptoms that are really relevant for our MS patients and for patients' well-being.
Wow. Is there anything else that we haven't covered? I feel like we've
I think we covered amazing set of
range.
things, including body fluid biomarkers and MS care in general.
Yes, thank you so much for joining us on MD Newsline. It's been a pleasure.
Wonderful.